Having had a good track record of containing the coronavirus so far, most tourism-dependent Caribbean islands are announcing plans to reopen their borders to international travelers this week and in early July. The Grenada Cabinet, for example, announced that they will be reopening their international airports on July 1st to international and regional traffic. This reopening is happening against the backdrop of a warning issued by the World Health Organization, who is suggesting that the world has entered, quote, a new and dangerous phase of the coronavirus pandemic. And as there has been a significant spike in coronavirus cases in the Sunbelt region of the United States and in other parts of the Americas, including Brazil.
The world is in a new and dangerous phase. Many people are understandably fed up with being at home. Countries are understandably eager to open up their societies and economies.
This morning, I am joined by a team of public health experts from the region, including the Executive Director of the Caribbean Public Health Agency, Dr. Joy St. John, who is based in Barbados, Dr. Francis Martin, the Acting Chief Medical Officer of the Grenada Ministry of Health, and Dr. Rowan Jeremiah, Associate Professor for Community Health Sciences at the University of Illinois at the Chicago School of Public Health. We will be having a post-mortem discussion on the region's handling of the virus and plans to keep infections at bay as international travelers are allowed to re-enter the Caribbean. It is Sunday, June 21st, 2020. It is also National Indigenous Peoples Day in Canada. We say Happy Indigenous Peoples Day to the First Nations, Inuit, and Métis people of Canada. It is also Father's Day. Happy Father's Day to all dads. This is the Bub Report, Sunday edition. And a pleasant good morning to everyone, and welcome to another edition of the Bub Report Sunday edition. I'm happy that you can join us this morning. It is also Father's Day, and so I extend a happy Father's Day to all fathers who are joining us on the stream. And I trust that you would have an amazing day today. And please let us use this day not to bash the good fathers or to bash fathers at all. This is Father's Day, and let us give them that credit. Certainly, there are fathers who have their issues, but today is not a day for that. It is a day to celebrate fathers, right? So let me say thanks to everyone for joining us. We have a very interesting panel this morning. We will be discussing the reopening of Caribbean economies in the wake of COVID-19. Of course, we are still in the first wave of the pandemic, and as such, the Caribbean is walking a very fine tightrope with respect to managing infections and also ensuring that they have continued economic activity. We will begin this morning with an interview that I conducted with the Executive Director of the Caribbean Public Health Agency. That's Dr. Joyce St. John, who is based in Barbados. We spoke last week. Understandably, she had a very busy schedule, but she made some time for us. And what we did was that we had a conversation with her about the Caribbean's response to the COVID-19 pandemic. So I will play that interview now. And when we return, I will be joined by Dr. Martin, who is out there in Grenada, as well as Dr. Rohan Jeremiah, who is in Chicago. He actually worked at St. George's University, and he also a lot of his parents are, I believe, are from Grenada as well. So thank you for joining us, and do enjoy this interview that I'm about to play for you right now. That is Dr. Joyce St. John, a very busy woman out there doing the work of the Caribbean Public Health Agency. St. John, this has been a very challenging time for the agency. By way of post-mortem, I am told we have no sound on that audio. So let us take a break, and we will come back to resolve that issue. Give me 1 second here, and I will be right back. Thank you. I do apologize for that technical glitch. I would attempt to run that interview later on in the stream, or perhaps at another time. It will be uploaded on the page. But I'm happy to be joined by Dr. Francis Martin. Dr. Martin, good morning. How are you?
I am well, Kellon.
Okay, thank you for joining me, Dr. Martin. Off the bat, let's start. Grenada just you had your first repatriation flight, I believe, from North America. How did that go?
Um, it went well. It was the first opportunity for us to see what business would be like in the travel industry, and how our internal process should go in an effort to manage this issue. What was more important is for us to be able to identify our process and the procedures, report, to be able to see where bottlenecks are, where gaps are, how we can improve and streamline the process, because travel is going to change permanently. Just as 9/11 changed travel, COVID is certainly going to change travel as well.
Dr. Martin, are you concerned that there isn't a regional strategy for the region? Because certainly most Caribbean islands are open, but Trinidad and Tobago isn't open as yet. So, are there any kind of uniform policies in place that public health officials are discussing with the policymakers to ensure that that there can be a coordinated response? Because as you would imagine, if there isn't a coordinated response, you may run into issues.
Yeah, certainly. I mean, that is going to be a consideration for all policymakers and administrators in the Caribbean. And I think CARICOM has recognized that. And since the beginning of the COVID response, CARICOM has been very instrumental in ensuring and empowering our regional institutions to have a regional approach to it. So I am certain that there is, in fact, the discussion has already started regionally for a coordinated approach. Even the chief medical officers, we meet with CARPHA and under the directorship of Dr. Joyce and John to continue that discussion. We meet every week and communicate with each other almost every day. So at the end of the day, I think we all recognize that it needs to be a regional approach, and I think this is the desire of us all.
Okay, it's a desire, but what steps are being taken to ensure that that can happen soon? Because we opened our borders for the most part.
Well, I think it has to start on the discussion table.
Okay.
And it has.
Okay. All right. Now, there were reports about H1N1 last week in Grenada. Now, would you say that infection has been brought under control?
Well, since 2009, it has been the pandemic started in 2009, and I think the region started becoming very concerned in the early teens, and so every year countries have to check to see what's circulating. And as a matter of fact, our COVID pandemic plan was actually built on our influenza pandemic plan that came out of our initial response to H1N1 when it hit our region somewhere 2015, 2014, somewhere around there. So yes, it is there. It has been here. Last year, there were some reports in Trinidad, not anything to become of public health significance, but the fact that it is still here, it's important for us to keep thinking about it. So yeah, we have checked, and we have had reports of it as well.
Okay, now by way of postmortem, if you were to give your ministry a grade, or on a scale of 1 to 10, how would you say you performed in terms of your COVID response?
I haven't actually given a grade. I don't think I'm in a place to grade anything. I think we have to allow the impacts, the outcomes to grade that, or to see what our response is. My concern has always been looking at the threat, looking at the risk, and trying to mount a response to it as it comes. Because as you would have realized, or the world realized, the only thing we know about COVID is that there are no COVID specialists worldwide. There is nobody worldwide who can say they have all the information regarding COVID. So it was a matter of every day changing plans or building on what you have. When you see something happening in that end of the globe, then you respond that way. You see something happening. It's just as how our region responded to COVID at the beginning. When it was happening, when it was not in our region yet, our focus was on border control, where we improve or put all our efforts in the seaports and land and the airport. But as it changed and started affecting the United Kingdom and the United States, then as the threat becomes more imminent for us, we changed our strategy and focus on something else. That has been the modus operandi, where you constantly monitor and constantly assess your risk, where you are and what you do, and change as you go ahead. So I hope at the end of this whole pandemic, because COVID is not going to go away, I hope at the end of this pandemic, persons like yourself will be able to give us a grade, because I don't think I'm in a position to grade anything.
Okay. My next question to you, Dr. Martin, has to do with returning nationals. Could you clarify for us what that process looks like? Because I think a lot of people are still confused as to what the expectations are when they return to Grenada, right?
Right.
But there isn't, you would still have to go through a period of quarantine, right? And that cost is borne by the travel, right? So could you elucidate our viewers with respect to what that step-by-step process looks like for the time of the Caribbean island?
I must say here, just like COVID itself being unpredictable, again, people have to accept that we can plan as much as we know, but we have to expect things to change literally midair as things stabilize. What I think is most important for people to recognize is that if you travel, you will have to be quarantined for 14 days. That's across the board. Of course, circumstances may change depending on individuals, and a case-by-case basis may require you to stay maybe shorter, maybe longer, depending on so many other things. Like, for example, the World Health Organization is now suggesting that a 10-day quarantine might be what is necessary. You never know. By next month or so, it might be 10 days. But I think the general feeling is that persons must expect 2 weeks quarantining at their expense. And there may be assessment, there may be help given by, sponsors or government, but I don't want that to be an issue for people to be focused on. Must focus on the 2 weeks quarantine. And that's basically what we've been doing from our initial COVID response when it came out in Wuhan.
Is the cost of the quarantine, would that cost be borne by the traveler or by the government of Grenada?
I think the expectation is that the cost will be borne by the traveler. But as we have seen in so many of our neighbors and countries and what have you, there are instances where governments can assist, and government may be expected to assist in some instances. But the default is that you should expect to bear the expense of your own quarantine.
Would that be at a government quarantine facility, or can that person go at home and quarantine?
And that speaks to the different quarantining, because there are different circumstances under which quarantine can occur. And so some may have to be on the government mandatory quarantine. Some may be able to do home quarantine. Some may be able to do other types of quarantine. It really can't be a one-size-fits-all.
I don't mean to cut you, but how are you going to make that determination as to who would be quarantined at home versus who would be quarantined at a government quarantine facility?
I'll just give you one example. If there is an elderly person who lives by themselves, we know personally where they live. We know they're not mobile. We know that the chance of them going to a party is virtually non-existent, someone like that, consideration may be given to home quarantine in that instance. And that's an example of how we make some of these determinations. I recall during our early stages of our COVID response, in the very early stages, if you when our students from, let's say, China, for example, returned, if someone from China returned, you can easily say to that person, government quarantine for 2 weeks. Whereas if somebody visited us from Barbados during that time where there were no cases, we said no quarantining at that time. So sometimes those are the things we use to help us make those determinations.
A viewer is asking, Margaret Francis is asking, does the quarantine apply to locals only or visitors also?
It applies to everyone.
Okay, it applies to everyone. Okay. And another commenter, Wilbur Thomas, is saying the cost of stranded nationals in the U.S. is prohibitive. The idea that taxpayers have to pay for their own test in Grenada and still pay for quarantine with the added price of testing prepared for them is a tough call, especially for those who afford the cost. Mr. Martin, what say you? Dr. Martin.
Yeah, I agree that this is going to be a tough call for everyone. And not just here, I mean, everywhere people are going to be faced with those issues. And I do hope that the authorities on all our islands that have to do this will get a chance to, the authorities to take a due look at that. I mean, it's unfortunate that this thing is costing so much. My job is simply just the health aspect of it, not the economics of it or the cost of it. So I really do hope that administrators in our region find ways to help us and help our nationals deal with this matter.
Okay, Dr. Martin, we will take a break, and when we return, we will be joined by Dr. Rohan Jeremiah. I'm sure that is somebody you're familiar with, Dr. Martin?
Yes.
Yes. Are both of you gentlemen fathers?
Dr. Jeremiah, I think you are, right?
Am I what?
Are you a father?
No, I'm not. No, I'm not.
Okay.
I am a father. Dr. Jeremiah, it's really nice to see you.
Nice to see you as well.
All right, gentlemen, we will take a break, and we will be right back. Thank you. Please keep your questions coming. Because, you know, this is the perfect panel to answer a lot of these questions that you might be having on the reopening of Caribbean borders. Stay tuned. We'll be right back.
But the virus is still spreading fast. It is still deadly, and most people are still susceptible. We call on all countries and all people to exercise extreme vigilance. Continue maintaining your distance from others. Stay home if you feel sick. Keep covering your nose and mouth when you cough. Wear a mask when appropriate. Keep cleaning your hands. We continue to call on all countries to focus on the basics: find, isolate, test, and care for every case. Trace and quarantine every contact. As the pandemic gathers pace, it's the most vulnerable who will suffer the most. Refugees are particularly at risk of COVID-19 because they often have limited access to adequate shelter, water, nutrition, sanitation, and health services.
Stop moving. Simply stop moving. If you do not have the type of bread you like in your house, eat crackers. If you do not have bread, eat cereal. Eat oats. Sardines. You're supposed to have a 2-week supply for hurricane. And at the beginning of this, I said, prepare your disaster kit as if you would for a hurricane. That meant some people went out and buy toilet paper and water. The water is not going to stop. The toilet paper is still in the stores. What you need is food. You need to ensure that you have food, because if I have to take everybody who is saying that, at least 50%, shut it down completely, regardless. Food will also not be possible for 2 weeks for you to buy. because the workers in the food market will also have to stay home. Keep that in mind. But do not run to the supermarket today to buy for a month. As I said, buy for 1 to 2 weeks.
All right, welcome back. Dr. Jeremiah, thank you so much for joining us this morning. I would begin with you, Dr. Jeremiah, looking at the Caribbean region's response to COVID-19. How would you say the Caribbean region did?
I'm sorry, I'm unable to hear you.
Are you can't hear me?
Yeah, okay, now.
You hear me now?
Yeah.
So my
Okay.
question to you is, with respect to the Caribbean region's response to COVID-19, how would you rate their response?
I actually have been very impressed, particularly with the sort of regional coordination that's been happening, not only just in Grenada, but across the region. You know, obviously, there are existing bodies, whether it be the OECS, CARICOM, and other agencies. And so I think, you know, overall, everyone has done pretty well, given the fact that the numbers are not as high as many would have expected it to be. And also to the very strong sort of approach they took towards putting in issues to mitigate the problem. And so therefore, I generally would say that I'm very impressed and overall pleased with what they have done. Obviously, there's areas for improvement, given the fact that this is a relatively new and unknown sort of condition or health issue. But we can see that, you know, the practices of contact tracing, the quarantine, even though it's not perfect, they still have been able to sort of mitigate some of the problems and challenges. It could have been a lot worse than what we have seen so far.
What areas of improvement would you recommend?
And it's the areas of improvement are more so broadly, not just specific to this particular health issue, but more so overall. You know, one of the things that I think has become very apparent, not only just for the region, but also for around the world, is the significance and importance of public health. And thinking about public health beyond the clinical settings, such as clinics and hospitals, but also thinking about public health in the community. And also realizing that much of public health is also driven by individuals in the community. And so therefore, you know, building capacity within the community to take on more sort of a leadership role and more partnerships with health agencies and programs, I think that would be ways in which that we kind of look at sort of making some improvement there. And I think some of this can also extend beyond just the COVID. We can also think about this from the standpoint of disaster preparedness and response. We're in the middle of the hurricane season, and that's an added additional challenge that we now have to think about in addition to COVID. And so therefore, you know, having those partnerships and relationships will be very significant, both in terms of reducing the cost, but also to expanding resources and opportunities for folks to be engaged and involved.
Now, Dr. Jeremiah, you work in Chicago, right? I believe you are on the COVID-19 committee of the university that you work at.
I do.
And obviously, you would have seen the impact that COVID would have had on the Black community in general, not only African Americans, but, you know, Caribbean Americans in the North American diaspora would have been negatively impacted by this. Obviously, people are still concerned, and how can we ameliorate the high death rate that we are experiencing?
So the dynamics here are different. You know, one of the things that we're dealing with here, and this is a systematic problem, is that we often talk about health disparities. And we're talking about a healthcare system that has disenfranchised individuals of color for a very long time. The rates of death for COVID not only affects African Americans and Black Americans in general, but it also extended to Latino and Hispanics as well. And when you really look deeper and under the sort of rudimentary causes and challenges among this issue, it's more around access to care. And even if people have access to care, it's how they're treated when they're accessing those healthcare systems. There is a very high disproportionate number of individuals when they go to healthcare facilities, they don't feel like they're being listened to, or their issues are being addressed in a way in which that will reflect them being able to actually adhere to the sort of requirements. So, for example, a lot of the individual, there, a high percentage of African Americans as well as Latinos and Hispanics work in the service industry, and they have also been disproportionately affected by the unemployment rates. Now the economy is opening, but they're now going back into the sort of service industries, which are primarily the front lines where people are likely to most likely get infected when they're working either in hospitals or restaurants, hotels, and those types of things. And so therefore, that's an added burden that folks have to think about. And then also too, with access to care, the kind of care that they receive also exacerbates the problem.
Dr. Martin, I have a question here from the stream. It says, Dr. Martin, there has been talk of electronic surveillance, i.e. electronic wristbands or mobile app to be downloaded on an individual's phone. Can you comment on that? Let's unmute your mic there. Yes.
Oh, sorry. Yes, surveillance happens to be one of the major activities to help us curb the effects of COVID. And the level of surveillance that is needed, it was necessary for us to look into the possibility of technology use. There are different technologies around the world, but in our Grenada context, what we're looking at, or what we have started to use, is a mobile app on the phone. The risk is the risk band, or things like that have not been considered yet. So it is the mobile app that people are expected to use on their phone. We started using it with our returning nationals from the cruise industry. And then from Friday, our first repatriated flight, we've used it there as well. So it is, sometimes it's successful there, sometimes depending on the device the persons have, it may not necessarily work, but the technical team is continuing to work with them on it to be able to get it functional.
Persons have also expressed privacy concerns about these mobile apps. How are you balancing that?
It's a very fine balancing act, because the issue of confidentiality, and it's a worldwide discussion that is now ongoing with regards to COVID. Many countries have had to ask the same questions. Some authorities are doing it more mandatory than others, but obviously, I believe I agree with the caller or the person asking the question that privacy is definitely going to be an issue. But for a practitioner, I always have to keep my eyes on the bigger picture, which is the safety of humanity and itself. And in fact, if someone can sacrifice a bit of their privacy so that their loved ones are saved and their relatives can escape the effects of COVID, I think it's a worthy exchange.
It is, but certainly you would appreciate that there are opportunities, especially on social media, for folks to come up with conspiracy theories, as
Yes.
they have in this field. Now, Dr. Martin, and I will throw this question out to Mr. Jeremiah as well. You are public health experts. What are you doing? And I get that you have your press conferences every week to alert people as to what they should be concerned about. And Dr. Martin, I would go to you first. How do you respond specifically to these conspiracy theories that do have an impact on people's perception of COVID-19?
Yeah, I first of all, I listen attentively to hear from whence they're coming and what their perception is, because to be able to have them listen to me, I must understand their concerns and their fears. So I listen to all the conspiracy theories, and I try my best, using the best public health knowledge that I have and from my readings, to assist with them understanding why it doesn't make sense in our context. But I agree with you as a public health provider. I mean, there's so many things out there that can encourage one to think in that direction, that there is a bigger, more sinister move behind of all of this. But I don't allow that to distort my view on what we need to get done and how we go forward.
Dr. Jeremiah.
Yeah, my response to this has always been consider the source. Where is it originally coming from? And for me, I believe in the science behind public health. And so therefore, if it's not coming from a reliable scientific source that has been proven to be a reputable source, then I tell people to be very cautious about what they read and take in from social media.
Okay, we have another question. We have a couple other questions coming in. Dr. Martin, that one is directed to you. Will the download, again, of whatever application that is be mandatory or voluntary?
For now, it is mandatory. Persons would be expected to sign a quarantine agreement form when they get here. And that's one of the regulations on the quarantine agreement, that you agree to download the app. And of course, we are under a limited state of emergency. Persons must remember that. And so our Sanitary Council Act has been, is now implemented. That's what we're functioning under. So really and truly, it does give our authorities some ability to ensure that people comply to those regulations and comply to those guidelines.
What if there is no, what do you do in cases of non-compliance? Specifically to returning nationals, you may say, you know what, they will download the app today and they may be deleted tomorrow.
Right. I mean, we will have to work with that person as closely as we can, because at the end of the day, it is a returning national. We are very fortunate so far. Everyone has signed it. I had one situation on Friday where I needed to explain something a little further to one person before he signed, and he eventually signed. I hope that people would see the benefit of what we're trying to do. But I really can't speak to what's going to be done, except that, you know, if someone doesn't want to sign, I would have to refer them to my superiors for them to take a decision on it.
Would that be law enforcement?
That's included, but I also
law enforcement.
Need someone to learn. Not about.
I think what I'm trying to get at, are there criminal penalties for that the criminal penalties that exist currently for breaking the curfew, for example, under the State of Emergency Act? Would there be criminal penalties for not using the apps?
I can't speak to that. Honestly, I can't. We could probably engage our law enforcement persons, but I can't speak to this at the moment.
Okay, we have a couple of other questions here, and that one is directed to Dr. Jeremiah. Eben Dawson says, Dr. Jeremiah, which countries should take notes from the other? I'm guessing countries that would have done well in their responses.
I think the verdict is still out in terms of who has done a really good job. We're already starting to see new waves of things coming in. For a long time, when the onset of this came out, folks really talked or highlighted South Korea as being very good in its strategies. Taiwan was another place that people oftentimes cited for its practices. And as it relates to the previous discussion around apps, in both countries, they use technology as a way to address the issue when it comes to either contact tracing or trying to find out or locate individuals. So the use of apps and phones and electronic devices were those things that enabled those countries to be very successful.
Yes, go on.
Yeah, so it's still kind of out there in terms of who has done a really good job. Like I said, it's still occurring, so it's really hard to kind of determine exactly.
Maybe I can jump in there.
Martin, please.
Dr. Jeremiah, you could probably look at the CARICOM bubble. I don't know if you heard that term.
No, I have not heard that yet.
Do you want to expand on what the CARICOM bubble is?
We refer to ourselves as being in a bubble because we basically taught the effects of COVID through our CARICOM coordinated response. So maybe the world need to look and see what CARICOM did and maybe take a page from that book. I don't know. This is why we refer to it as a bubble, because we still, pretty much.
But you're about to burst that bubble. Wouldn't you agree that you're about to burst that bubble? I mean, you in Grenada, you guys, not only in Grenada, but I would say throughout the Caribbean. You guys are weaving a fine line there.
Yeah. I think we're about to stretch the bubble.
Not to stretch the bubble. Now, Dr. Martin, I think the same question would go to you. How do you share information with other public health agencies in the Caribbean about what works, what worked, what didn't work, what things can improve, like that?
We have various networks that we use for sharing information. PAHO WHO has always been there as a institution that we receive technical support from and do some level of reporting. But the major public health agency in the Caribbean is CARPHA, the Caribbean Public Health Agency. We have reporting requirements that countries must do on a weekly and monthly basis and sometimes quarterly basis. So in this context, we share information through reporting, through CARPHA and other agencies, and technical cooperation as well from CARPHA and us. Many of our guiding principles or guidelines or policies, many of them have their foundation in what CARPHA put together and suggest for us at Caribbean level. We even have a more, what I should say, real-time sharing of information using the technology again. When in our initial COVID response, when we were facing the challenge with the cruise ship industry regarding what was happening in the cruise ship, it was purely because of the use of technology that we were able to communicate with all CARICOM members from Jamaica all the way down to Guyana. And in real time, we were able to tell which of those ships are at risk and which ones countries should avoid. And that really saved the disaster for us. That was a major way of sharing information that I think could be a best practice going forward.
Mm-hmm. And we have another commenter, Cassandra Mitchell, is saying, what is the science saying about the effects of COVID-19 for nursing/expectant mothers? Initially, experts were not clear, but now we have seen the virus affecting both mothers and children.
Maybe I could start by agreeing with the caller that the science has not been very clear early. And we now know that it can affect mothers and children. And in fact, Grenada, we had our youngest person was 8 years old, affected by the virus. Although the science don't know a whole lot about it, what we do know is the impact and the effect it has on children, babies, and expecting mothers is very, very mild. In fact, the baby or the children that have had those COVID never showed any symptoms at all. So statistically, although it does affect children, statistically from a public health standpoint, we can still safely say that the COVID has spared infants and children. You can still safely say that because of the numbers that has been infected. So in public health language, you can safely say it has still spared children, and we hope it stays that way. I really don't want it to move or change its structure to be able to affect children, because that would really then be a disaster.
Dr. Jeremiah?
Yeah, I think it's the same sort of thoughts that I have about it. It's still unclear in terms of what the long-term implications are. But what we do know is that children don't show the severe symptoms that adults generally do, particularly adults who are either elderly or adults with other underlying conditions.
Okay, Dr. Martin, I would now turn to you before we take our final break and wrap up. There has been an article in the New Today newspaper, weekend June 20th, in which a Grenadian nurse highlighted some concerns with respect to lack of safety protocols at the hospital. Do you care to respond to the concerns that the nurse raised?
I think in early COVID response, every country have had concerns about adequacy of their response in terms of equipment. There is no country that could say that they were really prepared early in the response. So I don't know the details of that article, but overall I can say that in our initial COVID response, we had challenges, we had gaps. And that's the reason we reached out to our partners, PAHO and other areas, to be able to help us get to that level where we were prepared enough. And even recently, I had to respond to someone who asked me again. They said, if Grenada gets 150 COVID cases, that require hospitalization right now, would we be ready to manage it? And I says, that would be our maximum, 100 and something cases that just show up on your doorstep automatically, just drop from the sky. We will not be able to have adequate resources for that. No country has had adequate resources for the maximum numbers. But what I can say is that because we have meticulously gone through this and partnered with our folks, we are now at a position where we are able to give a good response if the cases come in as we expect them to come in. If they come in, sporadically, they come in, we will be able to do it. So I guess my answer to the question is, while we may not have had adequate resources to begin with, we are now at a place where we are a little bit more comfortable with our ability to respond.
Another commenter is asking, Cuba seems to have helped in Italy. Why don't we hear of Cuba? Or is Cuba part of the Caribbean bubble? Or I guess he's trying to say not part of the Caribbean bubble.
Well, Cuba has actually helped in the Caribbean. I think Cuba is part of our bubble. Cuba assisted with human resource in many of the Caribbean islands. Even here for us, we are able to get nurses and specialist doctors to assist with our COVID response. And so what you find is a lot of our health responses in the Caribbean, Cuba has always been a strategic partner, and I think Cuba will continue to play its role in our public health in the future.
And Dr. Jeremy, I would throw that question to you as well. I mean, the United States still has an embargo on Cuba, right? But you would have observed Cuba's internationalist response to this public health crisis in the way that they responded to other public health crises as well, including Ebola, and the way that they assisted West African countries with their Ebola response. Do you think that the time has come for the international community to recognize the legitimacy of Cuba as a bona fide public health country?
So that's more of a sort of political international relations kind of question. But here's what not only just in the Caribbean, Cuba is known all throughout the world, particularly for providing medical support and assistance. When I lived in South Africa, there were Cuban doctors in the rural clinics that I was working with as well too. So there has always been a very strong and good outreach and respect for the Cubans' contribution to the health sciences, as well as providing doctors and stuff like that. I think the question about whether or not the U.S. will acknowledge and recognize that, I think it's beyond public health. I think this is more of a sort of a international relationship.
Yeah.
And, it's been like this for a number of years, and I don't know if it will ever change.
All right. We will take a final break, gentlemen, and when we come back, we will have a wrap up. All right.
So, my friends, I want to salute publicly the doctors, the nurses, the orderlies, the lab technicians, the Dos Santos lab, which is proven to be one of excellent resource for us, such that other people who are having to rely and to send out tests to CARFA, we're able to do it here. I want to thank the Cayman Islands government, who we've been working quietly behind the scenes in the region. Even though we have 50,000 kits coming through PAHO, as I indicated to you the last time, we bought another 20,000 kits, which are the ones used in South Korea, but compatible with the machines that we have here, because we need to be able to stock up on these kits and stock up on the swabs. In fact, the biggest problem we have now is access to swabs, and therefore we've been managing that process. The leadership of PAHO, the leadership of CARFA has been absolutely brilliant in their interaction with us. I have been in contact with the Director General of the WHO twice.
All right, that was the Honorable Mayor Motley, outgoing Chair of Caritas and Prime Minister. Your reaction to Mia's comments there?
Sorry, I could not hear that again.
Did you hear that Mia clip?
Yes, I did.
Yeah. So I'm asking your reaction to her comments.
She is actually spot on. I mean, the respect that publicly people have shown for the medical community in this time is really palpable. I mean, I recall myself standing and was taking blood from a COVID positive person. And for a moment, I stood there and I was like, really, is this thing actually happening? It's an interesting situation when you're facing something like this. And to see how our medical doctors and nurses, orderlies, and the police officers and our security forces stood up to this is really commendable. So I feel for her. And she actually reiterated what I said earlier regarding where we got our strategic support from, that CARPHA played an integral role in what happened here and what you saw here in the Caribbean, and supported so much by PAHO. So between the governments and the dedication of governments to the belief in the science, and I must say this though, I don't know if Dr. Jeremiah has have any other experience, but certainly I feel that the governments of the Caribbean have listened to their scientists. They listened to what was being told to them, and they took the advice that the scientists gave. I think this is a major part in explaining what actually happened here in the region. So Prime Minister is spot on.
Dr. Jeremiah, he's saying that they listen to the scientists. The same can be said for other countries. I'm not going to name any names. Dr.
Sorry,
Jeremiah,
could you repeat that question again?
I said Dr. Martin was saying that he's giving credit to Caribbean policy to listen to scientists. And so my comment was that whereas Caribbean policymakers,
I'm unable to hear you.
You can't hear me? You may have to log off and log back in again. But Dr. Martin, I have to go to you on an issue of testing here. And in an article published, David Hinkson published an article in the Barbados Today newspaper. That was back in May. But he quoted CARPHA as saying that the rapid testing kits were not the best way to diagnose COVID-19 cases and should be used only under certain circumstances. How are you ensuring, and again, this is a concern that a lot of people have, how are you ensuring that you have reliability in testing, especially now that we're going to be reopening our borders and we have a greater influx of traffic?
Yeah, the use of rapid testing has always been a sore point in the public health response with COVID. But I don't think the world will escape having escape using rapid kits. It's going to be used in some form or fashion. So I think what has to happen is country has to draw up the algorithms as to how and when and what circumstance rapid tests will be done. And secondly, they must have ways of validating and verifying that the tests are actually as best as they can under the circumstances. This again is where I praise CARPHA for, because having recognized that for small island developing states, they will have to use rapid tests in some form or fashion. They have actually put together and continuing to help the region navigate through what tests can be used and which can be used. So we really rely on them a lot for leadership in that regard. But the gold standard for testing for COVID is still the PCR. And I will not renege on that. I will continue to support that. Once PCR can be done, that should be the preferred. As a matter of fact, the rapid test cannot be used to diagnose a case of COVID. So it can be used as a screening test. But we're very clear. If you want a diagnosis, you must go to PCR. So if there is someone that did a rapid test, and the rapid test say that that person was positive, you cannot use that positive results to diagnose or say that that person is positive. That person must receive a PCR before they can actually be ruled in as having COVID.
Now, there were concerns about the quality of testing kits that were received from China. How are you ensuring quality control in that area?
We are working together with PAHO and with CARPHA. Their lab technologists and biologists, they're doing our testing, they're doing our validations for us. And so whatever testing kits are being used, and whatever testing modalities are being used currently, we are validating this and constantly checking with CAFA to see and ensure that we're having the best test possible. So not just because we have our ability to test on island, we are periodically checking in with CAFA and periodically having training from PAHO to make sure that we have the best opportunity for the most accurate test.
We have a comment here. The comment of our defense says it wasn't only doctors and nurses, the cooks and environmental workers have to face all the dangers associated with cleaning and keeping the environment sanitized.
Yeah, that person, I'm really glad that person made that call, that comment, because in our own experience here on the island, that came in very, very significant. In fact, my heart really goes out to, and I think they probably know who it is, who I'm speaking about, the cleaners, the people who took care of the garbage, the groundsmen, those persons who had to help us manage that. It was a very heartwarming situation to see that they've themselves and put their health at risk to make sure that other persons are doing well. So I personally have great commendations for cleaners, for cooks, and the persons who dealt with garbage and everyone else who actually managed in COVID. As a matter of fact, those who manage the waste and so on probably have even higher risk than anything else because of what we know COVID has turned out to be.
Yep. And Dr. Jeremiah, as we wrap up, as the Caribbean begins to reopen their borders, any final pieces of parting advice you want to give?
Well, one is continue doing what you're doing, taking the very strong measures and practices that you're putting into place to ensure that your citizens and population is protected. Continue to work through the regional bodies. Also, as to what Dr. Martin said before, continue to listen to the science behind what we are dealing with. And finally, I think the last point that I want to make too is also related to appreciate and value the folks that are working on the front lines beyond just simply the healthcare workers, but also to the individuals that are working in other spaces and places that are frequented by individuals.
And Dr. Martin, before I go to you for final comments, I just want to have you respond to Cassandra Mitchell's question. She said, what measures are in place to ensure the proper disposal of the cases, especially given the current circumstances at the landfill? I don't know what those circumstances are.
Yeah, our garbage disposal, especially for COVID-related biological waste, is managed separately by a separate company. And to the person who asked that question a while ago, obviously that person has some idea of what's happening locally. On Friday, our Chief Environmental Health Officer had a meeting with the appropriate stakeholders to come up with a solution for dealing with what's happening at the landfills, especially now that we have quarantine sites separated in different places. So there will be biological waste that will be generated in different sites. So we are discussing it at the moment, and I trust that the team that met on Friday will come up with a solution for us to manage it.
And Dr. Martin, final comments from you.
My final comment is that I believe as a country, we're facing our biggest challenge with COVID. It was easier to manage when we had the lockdown, but the inevitable opening up, I don't know when that's going to be, but whenever it's going to be, it's going to be the biggest challenge you'd ever face, because we have to accept that COVID will come. Our challenge now is to mitigate and contain the virus so that it doesn't cause widespread devastation. And we really hope that our country people will continue to listen to us, and the folks will engage this necessary behavior change that is needed to keep COVID at bay.
Mitigation and containment. Those are words to live by, especially in this era. Gentlemen, thank you so much. Regrettably, there were some issues with the audio with Dr. St. John, but I will endeavor to upload that onto the Bub Reports page, YouTube and Facebook pages, so that you can hear what she had to say. She had some very interesting thought processes to articulate. And so I want to thank both gentlemen for appearing this morning. And to our viewers, thank you as always for tuning in every Sunday at 11. And happy Father's Day to all fathers again. Happy Indigenous Peoples Day to our First Nation brothers and sisters in Canada. This is Kellen Bub, and happy Sunday to everyone. Bye-bye.
Thank you.